Hello, I'm Dr. Victoria Sorley Aguilar, Feminine Flame MD, and I'm so happy that you're taking the time to learn about how menopause affects your body. First off, menopause is when it has been 1 year since your final menstrual period. You may know that low levels of estrogen during menopause can affect all aspects of our body and mind. That's because we have estrogen receptors in our entire body, from our brains to our skin, to our blood vessels, to our bones, and of course, our vulva, vagina, pelvic floor, and bladders. So with that in mind, we can begin to see how low levels of natural estrogen impacts and changes our entire body. Remember, the information in this video is for educational purposes only and does not replace individual medical advice from your doctor. Please also talk to your doctor about your particular medical condition. For this video, I want to talk about how menopause affects women's urinary and vaginal tissues. First and foremost is vaginal dryness. Without our normal estrogen levels, our vaginal walls can become less lubricated and less flexible. This can cause a sensation of vaginal dryness, itching, and burning, and it can make intimacy painful or even impossible, even if lubrication is used. With low levels of vaginal estrogen, the area around our urethra, that's where we urinate from. Our urethra is the connection to our bladder. So with low levels of vaginal estrogen, the area around our urethra starts to have less blood flow and less nerve sensation. So we can become more susceptible to urinary tract infections, bladder infections, and we can get pelvic floor weakness and bladder incontinence, where we might be sneezing and peeing, or we can't hold our pee back when we feel the urge to urinate. All because of low levels of estrogen in our pelvic floor, our bladder, our vagina, our vulva, and our urethra. Overall, this leads to the sensation of having to urinate more frequently and more urgently. These symptoms can affect more than 80% of middle-aged women. There are safe and effective treatments that can help, but sadly, most women aren't even aware that it's something that they could ask their doctors about, so most women are never treated for these symptoms. Remember that knowledge is power, and you can ask your doctor about topical vaginal estrogen and whether that's right for you, and you can also ask about over-the-counter vaginal moisturizers like Replens, which can be found at a pharmacy without a prescription. Taken as a whole, the symptoms in the vulva is the outside of the vagina, the outer part, and the symptoms in the bladder are known as genitourinary syndrome of menopause. Not surprising then that women in menopause suffering from all these changes could also have a drop in libido. So of course, our desire and our libido is impacted by so many different aspects of a woman's health and life situation. But to be clear, if sex is uncomfortable or painful, and if we're having dryness, that's definitely not going to help our libido. Subscribe to my channel for more menopause wisdom. And please share this video with the women in your life if you found it helpful. And you can also visit feminineflamemd.com for more menopause and sensual education, and you can learn about my online menopause mastery course with Feminine Flame MD. Thank you so much for watching. Viva la vulva!